great to be back for another issue of DermTube Daily Coverage. We're in Washington, D.C. at the American Academy of Dermatology, and with us is Dr. Ron Prusik from Chevy Chase, Maryland, who's going to be discussing comorbidities of psoriasis.
What I talked about at the AAD this year is the comorbidities associated with psoriasis. We know patients with psoriasis who have moderate to severe disease have a systemic inflammatory disease with associated comorbidities. So what we mean by comorbidities is that people have other associated diseases in addition to psoriasis and psoriatic arthritis. So some of the common things that people have are cardiovascular events, increased heart attacks, increased strokes, fatty liver disease, depression, and other issues. So studying the comorbidities gives us the opportunity to study a systemic inflammatory disease, and what we really need to understand is whether the treatments that we use to treat the psoriasis from the outside are actually going to improve the comorbidities on the inside of the body. So these are the kind of outcomes that we need to understand from a cost-effectiveness analysis to justify using expensive medications, and also we want to really improve the patient on the whole. So the question is whether these medications will do it or whether lifestyle and dietary changes can actually impact the disease and prevent comorbidities. I think that dermatologists should play a really important role in informing patients about these comorbidities, because a lot of the patients don't really know that they're predisposed to these comorbidities. For example, increased risk of heart attacks and strokes or fatty liver disease. And a lot of patients don't understand that some of the pain that they are having in their joints are related to their psoriasis and not just age-related or injury-related. So that's why when we see our patients, we have to ask them questions about psoriatic arthritis. Do they have joint stiffness in the morning? Do they have heel pain or elbow pain? Or have they ever had a finger or a toe that swelled up? Because those are all clues that they have psoriatic arthritis, and we can send them to a rheumatologist to get evaluated. Often when I talk to patients and I tell them about the risks of heart disease, they tell me they've never heard that before, and I'm the first one to tell them. So I think that's important because it's a wake-up call for a lot of people to get healthier and to eat better and to start exercising and to get on the right path to recovery. So I think that we do play an important role in informing patients about their risks and comorbidities. The takeaway point from the talk is to make sure that patients understand they have other risks other than just having a skin disease, and that letting them understand that losing weight and exercising and eating properly will impact these comorbidities. Because I think that it's depressing for people to know, not only do I have psoriasis and psoriatic arthritis, but now I'm at risk for all these other things. So I think that we should give them a positive influence by saying, well, there's things you can do to actually prevent these things from happening, or at least reduce the risk of them happening by losing weight, by exercising, by eating properly. And so I think that that should be important for people to know.